ambulance on average. That is appalling, isn't it?
It is. It's a catastrophe. And frankly, I've never seen the NHS in the state that it is today. It's at breaking point. It really is. You can take any number you like, but it's broadly all moving in the wrong direction. And by the way, this is not just a consequence of COVID. Waiting times have been getting worse now for a decade, since 2012. So if we keep doing what we've been doing over the course of the last decade, we're going to get what we've been getting, and that's a deterioration in performance. And obviously that's despite the best efforts of doctors, nurses, managers and other people who are on the front line. So something radically needs to change, and it needs to change quick.
Opinion, Alan, what would you do?
I think there's some short-term measures and there's some sort of longer-term ones. I think the short-term measures, for example, during COVID, because it was a national emergency, and what we've got to do is we've got to elevate this. The government has got to make the point that this is a national emergency on waiting times. We've got to do some of the measures that we did then. We recruited back into the NHS doctors and nurses who'd left. We've got to make it attractive for them to do so. Big part of the big problem is the lack of capacity, the shortage of staff, 150,000 people that we're missing at the moment. So we've got to get some of those guys back in quickly. We've got to use new technology. Again, during COVID, we created these virtual wards where we could monitor people in their homes, in the community. That had a really fantastic effect in those hospitals where it was implemented. It basically doubled the capacity of those wards in those hospitals and reduced readmission rates by about a third. There's some of that going on, but again, it needs elevating. It needs to be made a priority. That's the short term. The longer term is, look, this is going to take years to correct. The government's got to be honest with people. It's got to set out a very clear plan with stages, what we're going to see by when, and then it's going to have to undertake some radical reforms. Waiting times only fell when I was the Health Secretary, when we introduced radical reforms into the NHS. Money's important, but the reform is absolutely critical. And back then, remember, people had been waiting well over 18 months for a hospital operation. And in the end, over a number of years, we got it down to a maximum of 18 weeks. So it can be done, but it needs urgency. It needs an acknowledgement of the problem politically, and it needs an urgent plan of action for the long term.
So if what you're saying is that under Tony Blair, who you were working with, we were in a much better state, what then went wrong? Which of your policies were undone?
A number, unfortunately. So, for example, one of the big things that really changed was, if you remember, there was a big controversy in the early 2000s about these NHS foundation hospitals that I created, which were really about liberating people working at the front line, the doctors, the nurses, the manager, to get on with the jobs rather than be subject to all sorts of interference from the top. So they had a lot more autonomy. That's been undone. Unfortunately, and there's much more deep performance management from the centre now. If you remember, it was very controversial at the time, but for the first time I gave choice for patients so they could effectively shop around deciding what was the best hospital for them. I was indifferent as to whether that was a public hospital in the NHS or a private hospital, because in the end, we were going to pay for it. The taxpayer was going to pay. They were NHS patients being treated according to NHS values. There's much less focus now on patient choice, how we use the private sector. So a lot of these changes that were introduced have been diluted over the course of the last few years, and that has been calamitous in terms of its impact. So we need to go back to some of those measures, but we need to go forward and look at how we can use technology to ease the pressure on the hospitals. All the data tells you very consistently that 1 in 4 people who are in hospital today needn't ever be there. If you intervene early enough, if you intervene what they call upstream before the illness gets too serious, and if you provide the right care in the community by investing in primary care, community infrastructure, and critically, this new technology that we now have available to us. So that's what the government needs to get on and do.